Young people's lives are so affected by what happens to their bones and their immune system, and it's dramatic. It may place them in a position in life in which they're trapped.
I've done surgery on patients that are 8 years old, and doing a hip or knee replacement on a patient that young. When you're going into the operating room, you want to achieve perfection.
I tore my cruciate ligaments in my left leg when I was 12. I learned about the great gift that a surgeon can give a growing person, and also about how exceptional special surgery is.
Mary came to me and said she wanted to bequest $1 million for research in my name. I was floored by that. And after thinking about it, I said I wanted to use it to start a research chair for inflammatory arthritis in Allan E's name, because he was my mentor and I wouldn't be doing the things that I'm doing today without his efforts. Allan was one of the pioneers here at the Hospital for Special Surgery. He's one of the best teachers I've ever come across, and really has taught me a lot about the care of patients with inflammatory arthritis.
And that's very typically Dr. Figgie. He would not just put his name on it. He would find some people to celebrate.
In 2005, when Meredith was in 5th grade, she was unable to walk.
She was a healthy baby, and then around 10 months, she started developing a rash. It was juvenile rheumatoid arthritis.
The biggest thing for me when I was younger was wanting to fit in. In elementary school, I walked with a 30-degree bend in my knees, so I didn't walk straight. It was so hard being a kid and being in a wheelchair or walking differently, because you feel like everyone's judging you.
When I was a lot younger, I didn't really know what she had, what was wrong. But I remember my parents always say no, she has trouble walking, and I could always see it on her face. She would feel maybe kind of different.
Going into 5th grade, September just stopped walking.
We had an MRI and found that she was completely bone on bone. When we went to HSS, we got the diagnosis that she's going to have her knees replaced.
And at 12 years old and very small bone, custom implants were required for her.
The standard stem design was just too big. It wouldn't fit. So we had to come up with a design to accommodate her anatomy.
Some of the research effort is directed towards creating better implants for patients with juvenile inflammatory arthritis. These patients get arthritis at an early age. It affects their growth plates. The bones don't develop properly. They have very challenging problems.
Where Dr. Figgie comes in at such a crucial point is, if you are in a wheelchair for over a year or so, you're probably never going to get out of a wheelchair.
Had it not been for Dr. Figgie, I don't know where we would be or where Meredith would be.
Meredith was 12 years old, and it was life-changing for us and for Meredith.
To see how far she's come because of that, that's amazing.
They pretty much gave Meredith her life back.
It was cool to see my legs straight and everything and be able to walk normally. I'm able to walk around campus. I'm able to drive. I'm able to graduate college.
She's graduated from college, living independently in another city without any assistance. We have Dr. Figgie and the staff at HSS to thank for that.
It feels great. Seeing how we can help these patients is incredibly rewarding.
One of the things that was reassuring for my wife and I was that the care that we would get at the Hospital for Special Surgery was second to none.
He has made possible a gift. He has changed a life dramatically.
It's been a tremendous journey so far, and through the guidance and help of Mary Waldron, John Raggio, Richard Menschel, we've made a tremendous amount of progress in a fairly short time.